Today's podcast is brought to you by Cascade Health Alliance. Today, joining us is Dr. Raul Mirande. Welcome, Dr. Mirande.
Thank you, Ty.
So, Dr. Mirande, can you give us a little bit background about yourself? How did you become a general surgeon, and how did you land in Klamath Falls?
Sure. So I finished my residency in general surgery at Loyola, and there was an ad in the back of one of the journals. I was about the size of a fortune cookie, and it said, two Southern Oregon surgeons looking for a third. So my wife and I came out, and drove up from the Bay Area through beautiful Shasta passing lakes and came to Oregon's largest lake at Klamath Falls. So that was 1994. We moved here with our two boys in 1995, and I've been here for 28 years.
So if there are other general surgeons who are looking at Klamath County to want to come and practice, what would you tell them?
I would tell them exactly what I told Dr. Juan, who joined us this last year. I said, if you want to have a career with the full breadth of general surgery, vascular, thoracic, this is the place for that kind of a career. If you like seeing your patients out when you're shopping at Fred Meyer, you're taking your kids to the same school, you're enjoying, what the community has to offer, Klamath Falls is the place.
And you've been part of Cascade Health Alliance for a while. Can you speak to the role that Cascade Health Alliance play within the healthcare system in Klamath Falls and the greater surrounding area?
Oh, Cascade Health Alliance is a critical organization for local healthcare. We take care of over 25,000 members. And if you look at our population, it's a very large portion. And I think without it, it would be difficult to recruit both primary care providers and the specialty services that you want to see in the town. And without it, you would also have the hospital not able to bring state-of-the-art improvements, expansions that we've seen in the emergency room and the operating room. All of that comes from having a very strong Medicaid service here.
Got it. So what are the advantages do you see with the CCO model, the coordinated care model that we're in now?
Yeah. So you're able to align a three-party organization that includes our local hospitals, Sky Lakes Medical Center, primary care providers, and all of the specialists. And so given the fact that we all live in or about Klamath Falls, if you're going to take care of the numbers that I've talked about, tens of thousands of patients, both with Medicaid and Medicare, if you're going to get big projects completed, if you're going to be able to make advancements, it takes collaboration between those three parties. And we're able to do that meeting together multiple times every month about what healthcare needs in Klamath.
So when you look at the community partnership, what inspired you to join the CHA board?
Well, it's such a critical organization. It made sense to have a seat at the table. I'm able to both directly and indirectly improve specialty care, both for the members and for the providers.
And where do you see the future of specialty care in Klamath?
So again, you need somebody who wants to be in this type of a rural area, and I could go on about the advantages of that.
Please speak about that some more.
Oh, well, basically, I raised three kids here in the public schools. They were involved in everything, and even as a surgeon, I was involved with my kids' lives. I have a lot of photos where I'm in scrubs, but I'm present. I'm there. And I can tell you that many of my colleagues that stayed in larger cities spend hours in parking garages and driving. And it takes me 6 minutes to get to a trauma alert here, 6 minutes to get to the Biddy Fields at the YMCA. And I'm not a hunter. I don't fish, but I've loved hiking, biking, pickleball, kiteboarding. You have ski hills. Shasta had great powder yesterday, by the way. And those are the kind of things you can do in this area.
So how did the community partnership help the improve the lives of the community members within Klamath?
The partnerships. I'm assuming you're talking about.
Things like CASA, things like Klamath Health Authority.
Sure.
Yeah.
Sure. I think it comes down to the fact that we see each other in the same stores. We're eating out at the same restaurants. Our kids are experiencing the same schools. And so when there are issues in town, you don't have to try to explain what the problem is because the person you're talking to has experienced the same thing. And so when it comes to improvements, you've already passed the first hurdle, which is the acknowledgement of this could be better. How can we improve this? And then you can talk to people that have different resources. So,
As you look back at your illustrious career, you're still working, it's still over 28 years. What has been the most rewarding moment for you personally working with Cascade Health Alliance?
oh, wow. Um, well, there have
I thought it
been,
was me.
it was you, absolutely. Well, I was going to say, you were there for several of the milestones. This organization hitting its 25th year. I still have the water bottle. Um, Getting together with a Medicare product so that we could support more members. Those are two of the big ones. There are day-to-day wins, and just like there can be day-to-day frustrations that you collaborate and work through.
So, how do you see the current state of healthcare in Klamath and generally?
So the hospital has been really strong. This is the one hospital, like I said, I've worked at for 28 years. COVID took a toll. It exposed some weaknesses in the system overall. You could see the human toll in the sense that, and it's not just nursing and techs. You have physicians that said, I've seen enough, and they're bowing out, they're looking at different careers. And that has been a major issue, having to bring nurses, techs in the OR. We had to curtail some of our elective surgery, not only because of bed space, due to not having enough nurses, even with locums providers, but having enough surgical techs to complete the procedures. And that is going to be slow to improve. You don't just turn that over. But for example, what came out of the COVID years and identifying where we had supply issues is right now they're collaborating with one of our local community centers, and we're going to put together a surgical tech program, which completely makes sense. They both educate nurses that come over. We have imaging techs that are in our vascular department, and they're taking x-rays with me. We needed to have surgery techs. That's another thing you can do with a small town. Essentially, my small role in that was getting to talk to the president at KCC, going to talk to the biologic science instructor that's in charge and saying, this is a need. That's all they needed to hear. And in 1 year, it's put together and it's going to start. So,
Well, we talked about workforce development and talent acquisition, and trying to breed. I mean, because there are talent shortage, and we're trying to find innovative ways of creating talent. It sounds like you're doing that with the surgical tech and KCC.
we are,
Okay.
right?
All right. And the ideal type of student locally who's looking at this surgical tech program, what will you tell a high school person who's listening to you and say, gosh, you know what? I want to be part of that.
That's a great question because if you go like I have to the high schools and talk about career in medicine and in nursing, they see finishing high school, hopefully at the top of their class. They don't have to be number one, but they have to maintain. Then they're going to go into either a 2 or 4 year program for nursing and then come out. So they see that in this case, they can get their associate's degree in 2 years. And when you're coming out, you're making 40,000 plus for somebody that 2 years previously was in high school. And you're mobile. You take that skill. We're always going to need surgical technicians. And so, yep.
That's great. That's great. So, we've heard and we've seen you talked about the pandemic and something around provider burnout. Is that real, or can you talk to that?
Oh, sure. I can talk about it. Um, it is real, and it's very hard to what should I say, stereotype, because there are people that put the same hours in but seem exhausted doing it. And you can compare, part of that is a personality, it's an attitude to their job, how much autonomy. You know that I'm not employed as a surgeon. I have a lot of autonomy. I think that's critically important for my own well-being. Like I mentioned, I was at Shasta on a Monday. That almost seems obscene, but it was perfect timing. And there are there are roles that get mandated by an employer. I think that takes, for some people, a lot of the joy out of the job, kind of hitting their numbers of patients, how many contacts are they going to make. You cannot get away from the fact that it's a financial institution that needs to be solvent. And so you can look at the finances and you can look at the amount of people that need access. And so they're constantly being pushed to see a greater number of people in the same amount of time. And so COVID was difficult because, one, we were all learning while running. You were getting information about what was the best approach, and that changed as we saw during the several years. Um, Essential providers became where, for example, your ICU pulmonary doctors were number one. When you were listening to a podcast or the news, it was about the ICUs being overrun and who was taking care of them. And surgeons were having their cases canceled or held. Luckily, again, coming back to the autonomy of having my own office and being able to do a lot of things during the COVID time period that didn't require the hospital. So that was helpful.
So, do you see when you look at the healthcare industry and you look at surgery particularly, or specialty care particularly, do you see there being a gap or shortage of specialists coming into rural area relative to urban area?
Oh, there's a gap everywhere. And this was another thing that got exposed during the COVID years. What I've only seen one article in the paper that alluded to this, and that is the amount of patients that cannot get into a specialist, not only locally, but for things that we need to go out of area. It's months. And there doesn't seem to be a quick remedy to how we're going to deal with that, because I told you some people are just giving up their practice or slowing down. That's how they're dealing with their well-being. Overall, the system is, I have 2 kids who are going through med school and now residency. And what I've noticed is that we're having many more young adults completing med school, whether it be through an MD, a DO program, out of the country, but they're funneling into the same number of residency spots. We haven't improved that, despite the fact that our population's getting older. We're needing more services. So it's not just rural. That is a problem overall. And you're going to hear somebody, they're going to wake up one day and say, we need to fund more med schools, more residencies. That's the only way you're eventually going to get the number of specialists and providers in general that you need.
Got it.
Yeah.
So, You talked about access, and we talked about, social economic, social determinants of health, driver of towards healthcare. Can you speak to Char's role in terms of funding some of the social determinants health needs like housing, like parks, and like helping our members bridge some of those barriers so that they can live their healthy lives?
Sure. It's a huge question, the social determinants of health and how we're involved. I can think over the years being involved at the senior center, helping them get the kitchen with the number of meals that they create, improving multiple parks, setting up a system of transportation so patients can literally get to their physician, get to their pharmacy, pick it up, and have embedded the potential to have a provider finding out if there's a need that's not being met while they're driving. Those are all hugely beneficial. Housing is an issue globally, and with no easy answer. Um, the other day, I sent article from the newspaper that just said they're having to house people in hotels and motels. That's the only readily available sites. I think they're hitting that in LA, and you're going to see that. And um, I don't know the financial setup, but that is something that an organization like ours, with over 25,000 local members, we would be somebody to move the needle. I don't know who else is going to do that. The bigger question in terms of healthcare would be emphasizing that each of our members get into their physician to pick up issues before it becomes an emergency room visit, and it's something that could have been staved off. The other thing, and this is always the hardest, is they're reminded that the most important thing for the member is better eating, better sleep, more movement, no smoking, less alcohol. I think everybody can agree with it, but they don't get reminded unless they're seeing their physician.
When you look back and you talk historically about moving healthcare from acute care to prevention and wellness, can you talk about how important is annual comprehensive care visit is to a member?
Oh, so an annual comprehensive visit for the member seeing their primary care provider, it's important on multiple levels. One, as I mentioned, you are identifying problems that may be under the radar that can be immediately identified, treated. You have a treatment plan. And so you're keeping that patient out of the emergency room. You're keeping them from being admitted. We know some of the big disease systems that really lead to multiple admissions, cardiac, renal, breathing issues, and that came back to the smoking. So you have to put yourself in front of the physician. It's something that also benefits the company from letting us know who are the patients that may need added services that are we provide. They just don't know about it. And if we're not in contact with each other, we're both missing out.
And one last question: if one of our members are looking at viewing this podcast, what will you tell them the major significance of why they need to go see their doctor for the annual comprehensive care visits as we move away from um, acute care to more wellness and prevention?
So again, the annual comprehensive visit will look at the totality of the patient. It'll look at past issues that might have not been documented. And although they were, because you have an electronic health record, just because it's listed doesn't mean it's being attended to. And it reminds the provider, it allows the patient both for acute issues and chronic needs to get in front of their provider and get that looked at. I think overall, for their general well-being, you're trying to keep people out of the hospital, moving and independent, and I think that takes getting in front of their provider.
Raul, thank you so much.
So you're welcome. Thanks for having me.
Thank you so much for listening to our podcast with Dr. Raul Mirande. If you want to learn more and listening to more about the podcast, please follow us on our webpage.